name is Dunsin Oluwadunsin Oluwanfeni. I work here as a senior associate.
My name is Muhammad Okorie. I work in UNICEF. I'm the program manager for UNICEF Lagos office. I'm also the social policy manager. Two things together, but complementary. Yes, the knowledge of social policy empowers me to understand the different issues and the vulnerabilities that affect children across board, education, health, nutrition, child protection, and so on. So with that, I'm able to now manage colleagues who are technical experts in those areas to be able to provide guidance and looking at the big picture on how we can actually address this, working with the partners, government partners, non-governmental partners, so on and so forth.
On the issue of social policy, yes. I mean, you've mentioned social policy already.
Yes.
How do you think it affects your interaction? I believe you work, like you mentioned, you work with children and children-related issues.
Yes.
How does it affect your work directly?
Yes. And when you talk about policy, generally, those are actions of government. Let me start from social inclusion, because some of those start from social inclusion. There are a lot of factors that exclude people from accessing their rights. And the essence of government is actually to give people welfare, security, and so on and so forth. But we know that there are factors once in a while that socially exclude people. And for those reasons, government put in policies and programs to bring them on board. Some of those policies could be one of those issues is poverty, sex, religion, disability, gender, and so many things actually come in at different times to really exclude some people from accessing or even participating actively in the society around them and contributing meaningfully. So for us to address these issues and bring everybody to that level playing ground where people participate, benefit from services available, and have their voices, there has to be factors that socially include them. So that brings us to social inclusion. And as part of that social inclusion, you're now talking about the policies and actions of government. You get those things to happen. So that at the end of the day, government is for everybody, and we all benefit from the policies and programs of government. So, but when you now bring it back down to UNICEF, now we're looking at social policy, looking at broad areas, key broad areas. One of them are, what are the vulnerabilities? What is the poverty status of people? When I say poverty now, we might begin to look at poverty usually from the monetary perspective. But we know that when it comes to poverty, the issues we're talking about is monetary poverty, when it has to deal with actually consumption, the ability, the finances you've got, or the resources you've got to meet your basic needs. So it can be income poverty, as we call it. But with the difficulty in measuring income, the proxy that is used for monetary poverty is usually the consumption. Because when you have the resources, it's actually what did the resources buy for you? What are the consumption? You need to consume certain goods and services, like nutrition and other things. Then, but the other side of poverty is the multidimensional poverty. When you get to multidimensional poverty, you're not talking about education poverty. It's our right to go to school. Every child has the right to go to school. Every child has the right to nutrition services, health services. It all starts with even the safety of the mother before the child is born. Then exclusive breastfeeding, infant feeding options, and all of those. It comes to education, it comes to protection, and so on and so forth. So we look at it from there. Where you don't have that access, that's when we begin to look at multidimensional poverty. So in terms of my work in UNICEF, as social policy, we're not looking at those deprivations. Who are those who are deprived? In what? And where are they? So by the time you get that, then the next thematic area of my work as social policy is now looking at social protection. What are those services, policies, and programs of government that address poverty and economic shocks and the vulnerabilities? And what do you do to be able to bring people, lift them from poverty and bring them to that level of life of dignity? So social protection,
I want to zero in on multidimensional poverty. Where does Nigeria stand? Then we talk about Southwest, because we are in the Southwest.
Absolutely.
I mean, that's our context. That's the context of this conversation. So where does Nigeria stand? And then where does Southwest stand compared to other regions. Zones in Nigeria?
Okay, well, one of the things we all know is that right now is that Nigeria is mentioned as a poverty capital of the world. Which means the number of Nigerians that are poor multidimensionally is unacceptable. And we don't just say, oh, this is where Nigeria is. There is actually some good measurement of that. And the latest, which came out in 2023, is the Multidimensional Poverty Index, the MPI, that have partners, Oxford, Nigerian Bureau of Statistics, UNICEF, and others come together to carry out these statistics. And it shows at that time that over 130 million Nigerians are poor. And then we know that there are also dynamics to this in terms of rural-urban differences, more people in the poor in the urban rural areas than in the urban areas. And there are some regions that you have states that as poor as 89% of certain states live below poverty line and considered to be poor. But in the southwest here is relatively better than others. But when you look at it from the point of view of leave no one behind, then you find out that it's actually what nobody should experience. So irrespective of the rate, like the percentage, and I'll give you an example of one of the states in the southwest here, where if you are talking about 6% of the population as being poor, and you multiply 6% of about 20 million, then your population we're talking about, which is more than the population of a lot of states, you know, as a whole. And these are individuals that are poor within a state. And this happened before even some of the current policies that has also led people to the level of inflation right now that is going on, with other factors that have actually impoverished more people, where research estimated that from that 2023 till now, up to more than 9 million people must have also joined the list of people that are poor. Yeah, but like I said, the actual percentages of states, because we've got them, is computed in the Multidimensional Child Poverty Index that was released in 2023 to show specifically what percentage of the population is poor.
We see these things every day, right? And from the lens of social policy and how we lift people out of poverty, there's a whole lot. You had talked about how that we could talk about poverty from the lens of income, which is money at the end of the day, and how much you are able to earn.
Monetary poverty.
Yes, monetary poverty. And so you're now talking about multidimensional poverty. When I think about these things, I think about how that, I mean, it's not even just on paper. The more you earn, the better your standard of living across all the indices of poverty that you're talking about. So in lifting people out of all of this, in terms of social policy, we talk about funding. So do you want to just talk around funding?
Yes.
Availability of funding in lifting people out. Do you just dole out money to people?
Okay, now these are the issues when it comes to actually addressing poverty. There are programs that are designed to address poverty and vulnerability. And you know, when we talk about vulnerability, we're talking about economic shocks. And some of the things happening right now are economic shocks. For example, the removal of fuel subsidy.
Don't you think we should? They always say Nigerians are able to adapt to shocks like this. And it feels on the surface like we're actually getting by. If this is almost 2 years of this whole subsidy conversation, and we still call it a shock.
No, it's a shock. And now the survival strategies and the level of resilience of Nigeria is entirely different. The truth of the matter is that no one should live below certain level of dignity. Now that is a fact. You know, so the fact that people survive through different mechanisms, but again, when we look at some of the fact that people survive, you may also not want to look at maybe the crime rate, the rate at which people do other things they wouldn't have done to be able to survive. Now, but bringing you back to the issue here is that when poverty is rife like that, there are certain measures that are taken by government. And some of those measures are what is contained in the social protection. So there are social protection policies, social protection measures. And that's also one of the focus areas for social policy as it works with UNICEF. The federal government in 2017 developed a social protection policy, which has listed out different levels of vulnerabilities, because one thing about social protection is that there are financial barriers to accessing services, like we've said. And these issues cut across the life cycle. So it has a life cycle dimension to it. And what does that mean? It means that at these levels, certain programs have to be in place. Some of them come in terms of, what do we call them? There are some of them come in terms of transfers, we call them social assistance, where you do not need to contribute anything to be able to access services, or you do not need to contribute anything to access maybe like food vouchers or maybe free healthcare services. The fact that you fall within that category of people below the poverty line has guaranteed that. And we can see federal government doing a lot of them, pioneering a whole lot of them. You can see state governments also having it. We're in Oyo State right now as we speak, and Oyo State has a social protection policy, which has some measure of guarantees for poor and indigent citizens on what they are entitled to and what they are not entitled to. Free education measures, free uniforms, and so on. We also talk about insurance, health insurance. We talk about the pension schemes and all of those. They're all different because when you talk about social assistance, you also think about the social insurance as well. And insurance, health insurance is one of those key measures which states try to adopt. And part of their resources is supposed to fund the equity component of the insurance, where those who are not able to pay the premium, the state government pays for them. Because again, if you look at it, the amount of out-of-pocket expenditure by individuals is one of those factors that can actually drive people into poverty. So when you talk about insurance, it's also addressing it. Now, the third component of social policy work, which I'm now bringing to you, now addresses the issue of funding, and that is public financial management. So you look at one is generating evidence to show that, look, these are people who are deprived, and these are people who are not deprived. And that's when we mentioned about poverty measurement, multidimensional poverty index, right? Then we move from there to social protection, which is like an immediate form of intervention to get people out of poverty. And that's where you hear about the cash transfer, the federal government cash transfer systems that go to the poor and vulnerable across the country. Right now that is going on. Sometimes you hear 5,000 per state, sometimes you hear 25,000 and so on and so forth. These are direct intervention. But the most important now is public financial management. Government need to have a credible budget system that prioritizes the needs of the people, especially the poor and the vulnerable, and budget effectively for them and spend more for them. Because by the time the budget is implemented and it's credible, and it prioritizes the needs of the poor, then you begin to see that people are empowered to do business. We have the right business environment for people to thrive, do business and thrive. Because right now, we're not only talking about the safety nets that hold you from falling, but when you fall, there should be a kind of trampoline effect that you should be able to bounce back. And that talks about the resilience. Here in Nigeria, we've got some structures, wonderful family structures, community structures that help the poor. And these are some of the things you see that goes on, that you see the survival strategies. But are these what people should go through? Government should, because government has that responsibility to actually provide that environment where people thrive in their businesses and are able to sustain themselves. But when it becomes critical like this, government should also be able to fund social protection measures that help people to thrive. So budgeting is also very critical for us. And the last thing that we also look at is, what are the structures and the systems in place? And we look at issues around decentralization, for example. The government needs to have a blueprint and a plan that articulates its developmental needs and development agenda, that says in the next 5 years, these are how we want to address these issues in the area of health, human capital development, in the area of the economy, in the area of security, and so on and so forth. So in UNICEF, we also support states to develop such policies like their state development plans that helps them to articulate in a multi-sectoral manner, with the involvement of everybody, what is the agenda of the state. And how does the parastatals and infrastructure and institutions of government support that for government to get there? And beyond that, just like we were speaking a few hours ago, is what is the monitoring framework to ensure that some of those policies, that the different MDAs have their functions with clear mandates of what they should do and with clear indicators of how do we measure when they have achieved their result. Because if the education system functions well and is well funded, then the issue of out of school, for example, wouldn't be an issue. So also in health, the issue of zero dose that we have right now will be reduced if health sector is well funded and the funds are well managed, with, of course, with support of the private sector, the development partners, and everybody. But we need to all come together to address these issues, because that's where we have education poverty, health poverty, because these are key indicators and measures when you talk about multidimensional poverty. Yes.
Thank you. I want to speak into the effectiveness of some of these, maybe one or two of the schemes you've spoken about. I particularly heard you talk about cash transfers. I don't know if, to what extent are those things effective? Do they get to people they are actually meant for? That's on the one hand. Then you also talked about collaborative efforts. So we here, right, we have a lot of developmental conversations with the government in terms of policies and all that. To what extent do you at UNICEF partner with organizations that have these developmental conversations with government? Second, then thirdly, the issue of funding. So we've talked about having funding conversations with government. What external funding partners?
Okay. Yes, let me try and recall your questions. The first one is the effectiveness of the different programs
Yes.
that we've talked about.
Yes.
And you cited cash transfer, for example. Yes, I would say, while these are work in progress, great results are already been achieved. Because by the time you're able to bring meaning to the life of one person, by the time you're able to put one person back to school, by the time you're able to save one child from dying, malnutrition and so on and so forth, we're already doing things. But one of the things we're seeing right now is that both the federal and the state government will support from partners, development partners group, non-social protection, for example, which UNICEF happens to be one of them. One of those key areas that is being emphasized that is also achieving results already is the single social registers. So what that does is that, just like I said, and it ties back to the first point that I mentioned about the work of social policy, which is evidence generation. So they've gone through rigorous means to identify who is poor and where do they stay, with some geotaggings. Right now, we've come to an era, and it's still work in progress, where any government that is desirous of reaching the poor can reach them. Because almost all the 36 states of Nigeria and the FCT have single social registers, which of course will be updated from time to time. That's why I talked about economic shocks, that sometimes those who are not in their bracket falls into the bracket because of maybe one policy measure or maybe natural disasters or anything. So those single registers has names and addresses of individuals and households that meet such criteria. So if you talk about cash transfers, there are people through rigorous means that have been identified by government. And they're in a register and they are verifiable, that you can say, oh, this registers, it goes to them. Like I said, these are work in progress, but it shows that there is a structure in place to actually identify this people. So the era of programming in the dark is coming to an end, where you go into a community and you just decide to give and you don't know who is most at need. But one thing I must also emphasize at this point is that well-being and some of those interventions should actually be universal. Everybody should have access. But because we don't have adequate resources to have everything that people need, that's why we begin to do targeting. And when it comes to targeting, there is inclusion and exclusion error. So, but rather than exclude someone that needs something, you rather include someone that doesn't need it. So now that's why I said it's work in progress. We're trying to tighten it, revise some of the protocols, identify the new set of poor, because right now we've noticed from the time of COVID that there is new definition of poor. Like there is the urban poor. Before we used to think that everybody in the Bay Area, they're doing well at this. But with COVID, it became very apparent, and so many other things. So in terms of making sure that we target the people, there are instruments right now on ground that can support states to do that. But I believe there's still room for improvement. And the development partners are also working on it. I mean, UNICEF as one is also supporting them. The other one, in terms of collaboration and partnership, one thing I would also say at this point is the fact that under the principle of aid effectiveness, no development partner comes with its agenda. You should come and then fit into the agenda of the government you are supporting and the people you are supporting. So for everything we do as UNICEF, we are doing it in partnership with the state being at the driver's seat. And so the state determines their direction and we feed our mandate into their direction. And that's why I spoke about the state development plans. You have your development plan, you have their health strategies, you have your education strategies, and then development partners based on their mandates come to feed into it. So this is what is happening. So in terms of that, and again, that also explains why UNICEF is having a conversation with Down Commission. Because Down Commission, for example, is for the whole of the Southwest. And we can be talking about supporting maybe development in one state without thinking of the trickle effect of how it gets to everyone. Because our own resources is limited, but it's the mandate of government to drive those development across board. So we partner with Down Commission, bring our own technical expertise, which is most of what we have, with a little bit of catalytic fund, which we bring to the table to get things to happen. So in terms of partnership, that's where we thrive. Then the other thing we do is also to help government also broker some partnerships too. So, and I'll give you a practical example. Addressing issues of neonatal death in Oyo State, for example, is an issue. Oyo State and neighboring states is an issue. And what is one of those solutions, especially after COVID, is the issue of oxygen. So now UNICEF got private sector to support Oyo State by building state-of-the-art, I think one of the first amongst equal in the whole of West Africa, solarized oxygen plant, which is there at the Jericho Hospital there, funded by private sector organization, technical support from us, with ownership from government, to get that to happen. So it means that children should no longer die of preventable deaths because of lack of oxygen. And we also supported with establishment of a neonatal ward within that facility. So you can see how tripartite arrangement is happening. We are there as technical partners, but we're also working with government who are the owners, at the same time helping to also galvanize support from other private sector entities. You get this to happen. So these are some of the things we do. So we don't do it alone. We don't have our program. Government and the people who suffer. Government and the people who own the programs. The individuals belong to the states. But for us, we have a global mandate for full realization of the rights of the child wherever they are. So being in Oyo State, it means it's our mandate. Being in Lagos is our mandate, and everywhere. So that's on it in terms of partnership. And then we also don't do that alone, because when you're strengthening supply side, which is working with government, there's also the high need to strengthen the demand side. And the demand side, who does that more is the civil society groups, the community entities. People should go for those services where those services are available, and those are part of the things we do. But your final question about funding is an issue, and it has always been a global issue, funding. And the fact that needs to be made very clear that funding of developmental projects and ensuring the welfare of citizens remains the responsibility of government. Development partners like UNICEF is more of a technical partner and more of a funding partner. So, and if you look at the ratio of government versus ODAs, other development assistance, overseas development assistance, and all that, you find out that that's coming from partners is less than 3%, or let me say less than 5% of the total thing that government does. So what we do more is more of getting government to see the priorities for where they should spend their money. And that's why you have noticed, again, coming back to what social policy does, public financial management. You've got the resources. It's never adequate, we know. How do you prioritize? So put your resources where you need and where it can make more impact. And for us, also coming from our own angle as an organization that deals with children, we believe that when you spend on the children, you are spending on both today, and you're also spending on tomorrow. Because human capital development, you have to talk about health, talk about nutrition, you talk about education, talk about child protection itself, and other factors that makes the children of today to become the human capital of tomorrow. And also talking about issues around adolescents too. How do we transition from learning to earning, which is another program that UNICEF is also working with private sector organizations to address. So for us, funding has always been a problem, but budget credibility is an issue. And that is why we're working on that. And what's the best thing we can do is to get government to prioritize its own resources and use its own resources to achieve greater results. And then where there are gaps here and there, of course, there are other means of funding budgets, including the aid that comes from other organizations, from countries, and so on and so forth. But if you look at fiscal space diamond, the most important aspect that you can always use to improve your country, your state, your local government, and all of those always come from your own internal revenue. And the most others, before even thinking about the resources you get from outside, is now looking at efficiencies. How efficient are you even in the management of your resources? So sometimes you can save much more to do more things from efficiency saving, than even from borrowing and others. But of course, partners will still be there to provide those technical guidance, provide those international best practices, and some of those things that have been tried and has worked elsewhere. And then you contextualize it to your context, and it begins to work. So in terms of funding, it's been an issue. It will always be an issue, But while government expect that they will get resources and support from here and there, it's critical that government begins to look inward in terms of how do you increase your IGR. How do you become more efficient in managing the resources you have? How do you prioritize what is most important? How do you have a coordinated development plan that guides your implementation, that takes you to where you desire to be in the nearest future? And how do we stick to a plan that we think has the possibility of working without having to change them along the line all the time? Of course, we can tweak them and utilize technology to save and all of those. Think of other things, cost minimization measures. But one thing remains critical, is that the welfare and the security of the citizens remains the priority of government, and government will do it, and partners are only there to support. And then through that, we may be able to achieve more results.
That's a whole lot to unpack. But in simpler terms, for everyone, so we're saying that the responsibility lies in the hands of the government.
Absolutely.
And then there are several ways they can achieve this. increase revenue as much as you can, be more efficient with your spending, prioritize your spending, have frameworks that like reaches the people that really need all of this social welfare interventions and all of that. We talked about the social register. Beautiful direction. It was actually a question I was going to ask about innovation. How can we be leveraging innovation in achieving more?
Yeah.
Technology, AI these days, just to achieve more, to reach more people, bring more people out of poverty, out of all of these social issues that we've been talking around. I would really like you to target with the social register.
Okay. I think I did mention that while speaking about data, talking about data and so on and so on. You can't overemphasize the importance of data in what you do. Right. Yeah, you need to know where the gaps are. You need to understand the vulnerability. That's why for us in UNICEF, one of the things we support government to do is situation analysis, comprehensive situation analysis, which looks at the description of the problem. Then you begin to look at the capacity gaps. You begin to look at who has the mandate to do what. Do they have the capacity to do that? Are they funded enough to do that? What are the challenges? And then what are the recommendations? And those recommendations should actually form part of the operational plans we have every day in addressing these issues. So coming to social register, like I said, is innovative. You go to more developed countries, you find that people have their social security numbers. You actually know people, you understand people. I know government is doing massively well in terms of trying to achieve this data interoperability in the country. You understand? And it also starts from social register. From the birth registration. Yeah, one of the challenges we have right now is birth registration. And it's a key mandate for UNICEF. How many of our births are registered? No, because from there you begin to get the data. What kind of structures do you need? Do you need more schools? Which location? Where should you build more schools? It starts from the birth registration. What's happening? So by the time you begin to have this, you have births registered, is linked with the NIN, our NIN. That's when we're talking about data interoperability. Links with our NIN, then DVN. Of course, personal data security is critical in all of those. Right. And I want to believe that this is a given. But you begin to link this, then as things begin to happen, you begin to grow up in school, you've got your number and it is linked to this, the family, to this. You see, we begin to see some of these opportunities and begin to see where to leverage. And you see, when the data, now with the use of technology, you have the household name, the head of the household, you have all of those, then you begin to see, and you can actually track government spending to address some of these issues. If somebody is benefiting from free schooling, for example, you're able to see that. If somebody from the same household maybe has other issues and it has to do with education or with health, you're also able to track that. So you're able to know that within a household, because we're talking about, sometimes we have fragmented programs. You treat health as if health is the health you're providing in, let me use state A, let me use maybe Lagos or Ogun State, for example, as if the people you are trying to provide good health for, especially for children, are not the same children that you are trying to provide good education for. And they are not the same children you are trying to make sure that maybe depending on their age that you are looking at their nutritional status as well. Right. And when you talk about water, sanitation and hygiene, they're still the same people you're talking about water, sanitation and hygiene. And all these come together to make a total child that forms your workforce tomorrow, that helps to show up your economic growth because the numbers begin to come in. And then with the total management, you're having economic development that actually touches the lives of everybody. And so that at some point, because the more you have people who are capable, healthy, knowledgeable, and all this in your workforce, who are able to produce either as entrepreneurs, as government workers, or their own, whichever sectors they work in, the farms and all of those, that's also how you get, because when you say you get more tax or you get more revenue, it's not the ideal people that you're going to do this, because there are two ways. You empower people by providing the necessary environment for people to thrive, businesses to thrive, for people to work, then you get more income.
It's a cycle.
It's a cycle. And when you don't do that, you have more people to care for under social protection. Either as job seekers or as people, maybe an accident victim who can take care of his or her own health care, or you have people who should be in active workforce depending on retirees, all of that. And then, so it's a cycle and it's something that you need to manage very well. And data plays a very key role in all of those. Right. And there are a lot of things these days that AI can do. So in terms of relying on the old ways of doing things, the educational system needs to be overhauled to be in tandem with the realities of the 21st century. So that also has to happen. Within the health system too, so many things have to be automated now. And because one of the challenges we have is also this issue of data, this issue of knowing where our resources are going, what we're spending things on. There are so many things now that AI and technology can help us to do. So within the health sector, within the industries, everywhere. So those are the things we encourage government to do, and they are readily available. So government needs to step up in terms of creating the enabling environment for businesses to thrive, for individuals to use their talents, and then to create programs that really empowers the people. And that's why, like I said, UNICEF is partnering with so many private sector organizations now on the Generation Unlimited, GenU Niger, and the focus is on transition from learning to earning. Because it doesn't just stop at, oh, you've gone to this level of education. How do you utilize it? What next? What level of internship programs are there available? How do you help? These days, you talk about 20 years experience. It has to start somewhere,
Right.
and all of that. So there's a lot of issues, we can talk about. And I think technology and AI is just there. We should be talking about 21st century economy. And 21st century economy is driven by tech, is driven by data, is driven by information. Where we will have schools now that don't have computer labs, for example, irrespective of where they are.
Lastly, you had even started talking about the last question I was going to ask. It was just about seeing the future. How could leverage all of this social policy for creating the best conditions for like the next future? So I'm hearing things like Generation Unlimited. A really beautiful concept. I would really like to know more about it. I'll read up about it. But just in closing, what last remarks, what last words do you have for our viewers?
Well, I would say, being a Nigerian myself, Nigeria is a great country. Right. Nigeria has got great potentials. Right. We can do it. And like you said at the beginning, Nigeria has that can-do spirit. Nigeria also has that resilience. We survive what other countries cannot survive. So how do we harness this? How do we harness, our demographic dividend? We have a burgeoning youth population. How do we make the best use of the youths? How do we introduce them to the tech industry? How do we begin this whole idea of from school, looking at the end from the beginning? And that starts from when they are children. And that's where UNICEF comes in, for example, and others. Human capital development starts from the time a child is conceived. And so we need to prioritize those early stages of the child. One of the things we talk about in UNICEF, for example, is the first 1,000 days. Wow. What do we do within the first 1,000 days? Because the cognitive ability of a child within that time, whatever you're able to impute in there, the brain formation and all other things, is critical. A child within that time cannot have anything that leads to stunting, because that affects learning abilities and its lifelong impact that is irreversible. So at that point of the first 1,000 days and more, are the time to talk about immunization, cost-saving measures. That's the time you take the decision as parents, as government, and as a society to say that for this child, I want this child to be great. What does that mean? Is that as much as possible, that child must not come down with polio, for example. That child should be able to climb, for any reason there's no light in your cocoa house. That child should be able to come through the stairs. You understand? So those plans start from then. So whatever government can do, individuals, partners, corporate bodies, civil society, and community members, to really focus on the child, it determines where we go tomorrow. And that has to do with our education. How do we continue to talk about out-of-school children at this stage? So what are the policies of government? What are these things? And where are we budgeting our resources to? What are the quality of education we get today? The quality of education we get, are there the quality of education that can take a child for the 21st century? Does a child who finishes school, let me use one community A or community B, irrespective of wherever, if that child graduates today from secondary school or from primary school, can that child compete favorably? Can he use computer? Can he search? Can he do all the magical stuff that can be done? So you look at it from the nutrition point of view. A child that is being abused, a child that is not having all the rights fulfilled, and all of those that can, like I use immunization, for example, with the different antigens, addressing different things. If we don't invest in these, and that's why we define whatever you spend on children as not expenditure. We actually call them investments. You're actually investing in the future, not of just the future of the child, but in the future of the society and the community and the state and the country at large. So for us to have that bright future we're dreaming about, the time is now and the children are here. Of course, we can still salvage situations, and that's why, like I said, we're also talking about adolescents in UNICEF right now. So, but all these have to be put, and they have to be strategically and intentionally planned. There has to be some level of intentionality about it. So when it comes to funding, so what do you fund? Do you neglect those ones? No. So you must prioritize them so that by tomorrow we have those children of our dreams who are able to drive our economy. Nigerians thrive everywhere. What are the policy architecture of the country? What are the policy environments? You understand? So I think these are my last words is that, look, we've got the opportunity to make Nigeria great, but we have a critical population group that if we're able to target today, we're guaranteed of a better tomorrow. And they are the children, and their needs are cut across. And a lot of those needs are actually not expensive. They are investments. So if you look at that, sometimes you want to consider the cost of doing this, also consider the cost of inaction. When you don't do it, what does it cost? Which is cheaper.
More expensive.
So it's more expensive actually to not take action right now. So for that reason, I think we need to be further rededicated to addressing the issues that affect children, whether in nutrition, in health, in education, in wash, in protection, and so on, as well as the issues around adolescents and transiting from the world of least learning to earning as well. I think these are broad areas, which UNICEF works, and like I said, is for government to own them and run with them. We provide technical assistance, and then we're ready to partner with all the different institutions that are available down commission for one, because of your reach and your mandate within the region. But that is also something that should translate to every other state, using every other available structures, the academia, the research institutions, the civil society group, the traditional, of course, the media, the traditional institutions, the political institutions, everybody, religious, everybody. And it all starts because one thing for sure is that we are all duty bearers in a way, while those children and those in need are the right holders. And our mandate is to help fulfill their needs. So by the time their rights are achieved, we fulfilled our mandate as duty bearers, and they have achieved their rights. And at the end of the day, they'll come back to give us what we want in a society where it is thriving. And you see Nigeria with that is great potential, not just within the West African sub-region, but it goes to become one of those global countries that drive result, drive development. Nigerians do very well everywhere they go. And I think we can do better with the support of everyone.
Wow, that was a whole lot for a closing. Thank you so much, Mr. Mohammed.
Thank you very much.
It's good to have you here. Thank you everyone for staying with us. Have a beautiful rest of your day.